I don't want to get emotional, but it's an absolute honour to be able to welcome our first speaker. I don't think anyone in the room will disagree that this individual is the father of the introduction of robotic HPB surgery in the United Kingdom. He was also the best trainee that I ever had in Belfast. He learned nothing in Belfast and quickly caught up when he came over to the mainland. Jawad has navigated many of the obstacles to bring about robotic HPB surgery here in Coventry, but as you all know, and for all of the centres that are now doing robotic surgery, he gives up his time graciously to be a preceptor, to come to work with you in your theatres, with a real vision to be a leader in robotic surgery. I think when you look at the programme and our international speakers, and I enjoyed the company of two of our friends from the States coming over, I think you realise just the reach that Jawad has. So it gives me an absolute pleasure and an honour to welcome Jawad to the stage.
Thank you very much, Mark. Always looked up to you as my mentor, and thank you for your time in Belfast. Learned a lot from you, by the way. Also, how to stop bleeding. So, from vision to reality, 7 years. How did that happen? 7 years. 2018, I started robotic surgery. So when I was making this presentation, I got this ping on the LinkedIn and then a picture on Facebook, then and now. And so like 10 years I've been working here in Coventry. Feels like yesterday when I was like walking home and my daughter took this picture, and I was just like so full of energy and so happy that we finally will settle down as family, because we were like quite split here and there, training and all that, what happens. So Coventry, and couldn't have asked for a better place to work. I absolutely adore and love this place. It's so much to offer. It's a tertiary care hospital. We have the specialist services here. We have a very, very, very supportive team, and I mean it. Everybody is so supportive in this hospital. The charity, the CMO, the trust board, the colleagues, the management, all very supportive. And we are a small team. 4 HPB surgeons, we had 2 CNS to begin with. General surgery is quite a heavy takeover here. So most of our work in general surgery, and we do HPB on top of that. We have a cohesive MDT and IR support. So these were the basic ingredients to start a job in a HPB center. And then by sheer good luck, I came across Ed. Had never seen robotic surgery before, did not know what a robot does. And I mean, many have seen this slide before, so I apologize, but some for the new in this room who have not been in this room before, I just stumbled across Ed and I thought, like, let's do something new. And on May the 4th, I did my first independent cholecystectomy on the robot. That was my first case, and never looked back since. A few months later, I did distal total Whipple's procedure. So in a matter of like 6 months, I was able to do lots of cases that I did not know were possible with a robot, and there were not many doing in the UK at that time. There were only about 5 surgeons in the UK, and there was only 1 more surgeon doing these cases in the private sector in London. So there was like minimal preceptorship, minimal proctorship, and I just had to learn the hard way by doing it and recording my videos. And it was a painful to watch your own videos and making say, what are you doing? Cut there, you should have been doing this. So, and I was like a madman in the evening, just lights off and the family gone to sleep, and I was watching my videos and just like kicking my backside, like, why don't I do it this way? That's how I learned robotic surgery. But I was acutely aware of Coventry position in the UK. We are one of the smallest centers in the country on the basis of the workload we have. We don't have enough workload, and we were always threatened by our big neighbors, to the extent that we got this letter from commissioners in 2018 that stop pancreatic surgery. There's no more funding. Go general surgery only. Can't get anymore. But our brave CMO at that time, she wrote a very nice rebuttal and said, but no, hang on, we are doing a good job here. Yes, numbers are small, but look at the outcomes. We have a better outcome than our bigger neighbors. They do more, but their outcomes as collectively not as good as ours are. So that was a rebuttal at that time. So that was the bit of uncertainty we had in the background, and that's what I was facing: what to do, where to go. We kept going. Did more cases. Did total pancreatectomies, preserving ripples, right, left hepatectomy, just anything that came through the door in my office. I did that robotically. But whenever I went and spoke with people, and even in this room, when we met the first time, people were saying that, why are you doing this? It is such a big risk you are taking. If you do 10 ripples per year and one case goes south, which is possible, you have 10% mortality and you're outliers straight away. So you have to be careful there, mate. So that was unnerving. So I thought, like, let's meet up. Let's see what is the what state in the UK. What other people think about it. And so we got together in a hotel, and people said, well, you have done like nearly 100 cases by that time, and your outcomes are outstanding. So you need to shout out about Coventry and about the robotic surgery in the UK because nobody else is doing it. So I said, okay, let's do a conference. So that's how it started. In 2019, I went across and speak with people and ask them, guys, let's meet up. Let's do a conference and see what the lie of the land is. Invite some people. It was agenda was just on half a day, so we had about 7 talks because there was no one there to talk about. So on not many were doing it, and we had a good interest. We had about like 90 people in this room, 2019, to attend, and it was, I think, was a success because based on that conference, there was a surge in the orders for the new robotic system all around the country, and Coventry's position strengthened. So that was the impact the first conference had. But then, and then I kept going. So I kept publishing. I wrote the pathway for training that you all have to suffer through, level 1, 2, and 3. But it is working. And I was elected by membership to the Council GBI, ASGBI. So I was working hard in the background. And then these dreadful combination of events happened. We left Europe and we were hit by the pandemic. Everything came to a halt. What meant that for robotic HPB was that European proctors could not travel to the UK. They needed the work permit and the GMC. So people had robots sitting in their hospitals. There was no one to train them. There was no proctor. So they were just waiting for someone to come. So at that time, there were only 2 people in the UK who were eligible or had done enough cases to be able to train. And the other guy, he loved his Lamborghini and had to pay for it. So he chose to keep on working and pay for his Lamborghini. And I draw the short straw and became the first proctor for the UK. And there was only 5 at that time in Europe. And that was a big responsibility because I felt like now in a proctor, what do I want to achieve? My vision was to have everyone doing robotic surgery. Every single center in the UK should be doing robotic surgery because it is not only a kudos for the department, the surgeon, it's good for the patients. And you can see, like Joe, look at Joe Argue, look at a lot of people after Whipple's procedure, they go home for day 4, a distal pancreatectomy day 3, liver. Some liver patients go home the same day. Not possible in an open surgery. Laparoscopically, we, I think, had reached the limit of our competence, and we could not do the major case laparoscopically. So that's where we started. And so in July 21, I became the proctor, and then Guildford was my first project, and Tim Worthington, he was the first person I had the honor to start on the robot. So going from one of the smallest centers in the UK to one of the biggest centers in the UK and go and train them, and Tim Worthington could not have asked for a better start. These guys made me comfortable. I was nervous. It was hard work, and I was like feeling like, can I do this? Is it like really a bit of an imposter syndrome kicking in? I was very unsure of myself. But these guys, they supported me and I supported them. And then Angela and Raj, and then went to Oxford, Zahir and Mike, then went to Derby, Southampton, Liverpool. And then I basically like lost count. I was just traveling once or twice a week to different center, taking calls in the evening, supporting friends, talking with them, how to talk, why the clashing is happening, why can't they do? Why is the docking is not happening properly? It was just like a non-stop. But I was always there, and my catchphrase was, "I'll make time for you," and I did make time for everyone. And then I thought, like, let's meet up. We have done enough work. So 3 years later, I said, like, let's meet up and do the second conference. And in this room, we met again. This time, agenda was a bit bigger. We had still one day, but we had nearly like 18 talks to go through in one day. And we had about 190 people in this room, and it was like really fantastic to see the interest generated to the robotics. And currently, there are 23 centers in England, 23, and 19 do robotic surgery. And I've had the honor to train 16 of them. We started from level 1 cases, which is cholecystectomy, then level 2 distal panc and livers, and then level 3 Whipples and hepatectomy. So that's the impact. It has not been easy. Gosh, come on! Like last night, I could not sleep at all, and there has been like nights I could not sleep, and lots of strains on me personally, on family. So, but my wife was there for me, and I can't thank her enough. And you probably will see her in the evening, and my 3 children. But that's life. You just have to dust off your sandals and you have to just like move on. You have to paddle on. And thankfully, I had the support around me, the friends and family, and you guys. They kept me going. And here we are today at the third conference. And we had the honor of agenda over 2 days, packed program. We could have got more slides, more presentations, but we said like that's enough. Let's just keep it a little bit to 2 days. And then we have people from 10 countries, from the USA, from Singapore, Pakistan, India, Switzerland. There's speakers on the agenda. And delegates from 26 countries. We had to, this room can hold 250. I think the room is already like nearly 80% full, and there will be some sitting in the middle, but it's okay. Let's share the love, like let's learn from it, because we have one aim, and the aim is to promote robotic HPB to help our patients. The focus is on patients. It's not for me or you. It is for the patients. Hospitals and all that, saving money, cost is fine. All this is very important. But the most important thing for me is the patients. And we have done lots of complex cases with very, very good results. So what is the aim of these conferences? The first time we met was to introduce robotics to the UK community and generate interest, then evaluate progress and agree on a training pathway. So last time we did a live voting here, then we published the paper as well, that this pathway has now been accepted as the go-to pathway to train in robotic surgery. And then now the idea is to network, to meet people, some awesome surgeons who are in this room from UK, from abroad, just network, start some research projects, all with the aim of improving the outcome for robotic surgery, because we still can do better. And we can only do better collectively, not as individually. And what we have done so far? In 2019, there were 3 centers doing robotic surgery, and there were only 5 trained surgeons. We were not sure what is the role of robotic surgery. Is it like really will take off? Will it become the norm practice? And there was no UK trainer or case observer center in 2019. Then 2022, second conference, we had 10 centers doing robotic surgery. At that time, we had 23 trained surgeons. I became the proctor. And then we brought in case observation to the UK and the courses. So the TR courses are now done in St. Mark's. And it was very difficult to get that, but we made it happen, and we have training pathway. And now we have 19 out of 23 centers out of 23 doing robotic surgery. There are 39 trained surgeons. There are more surgeons doing robotic surgery in HPB center trained locally, but 39 are the ones that I know are in our WhatsApp group. And robotic surgery is now routine practice. We have 2 proctors here. Tim Pencavel is the second proctor, and he's doing a wonderful job. And we have case observation center in Guildford as well. We have courses, and we're already publishing some papers. I think 1 is like being accepted, and 3rd one is submitted. So that's my last slide. So finally, we've caught up with the rest of the world. We are doing some amazing work collectively. And robotic surgery, once considered futuristic, is now a routine practice in many HPB centers. And this conference will foster further collaboration, leading to research skills, and with the aim to improve our patient outcomes. Thank you so very much.
Perfect timing, Jawad. Excellent.